So I was born in 1959 in Severance Hospital, Severance 병원, and moved to the United States when I was 4 years old. My father was a dentist, my mother was a philosopher, and I grew up in Iowa. Iowa, 한국말로 아주 시골이라고. It's a very rural area. There were no other Koreans around. And so I grew up not knowing very much about Korea. But then I decided in my medical studies that I wanted to learn Korean again. And so I came back to Korea in 1984 and spent 2.5 years studying the Korean healthcare system. It was an incredible experience. I learned some Korean, of course, and I saw what this country was going through, this incredible transformation into a fully industrialized economy. But when I went back to the United States after my studies, I met a very inspiring person named Paul Farmer, and we started an organization called Partners in Health. Partners in Health now is one of the largest charitable organizations in the United States. Works in 12 different countries, has a budget of about $300 million a year, and is providing health care for some of the poorest people on the planet. In the midst of running this organization, Partners in Health, we kept running into experts, people in the public health world, who told us, what you guys are doing is not possible. You can't possibly do it at scale. It's too complicated. Things like treating tuberculosis that was resistant to the most powerful drugs. And probably the biggest struggle we took on was trying to bring treatment for HIV to the people of Africa. HIV in the early 2000s was mostly an epidemic of Africa. 25 million people were living with HIV in Africa. But at the time, the consensus of all the public health officials was that treating HIV in Africa was too expensive, too complicated, and just impossible. Well, for our organization, Partners in Health, that was just the kind of challenge that we like to take on. So we began treating our patients in Haiti with literally donated drugs. We found drugs from various places. We started treating patients with HIV in Haiti, and of course they had the same seemingly miraculous outcomes as they were having in all the rich parts of the world. So we took those results and we went to see the most powerful people, and were told again and again, whatever you did in Haiti is just an exception. It's impossible to treat HIV in Africa. Don't even think about it, forget about it. And so in 2003, I ran the campaign of Dr. Lee Jong-wook. Lee Jong-wook Baksa was a physician working in the World Health Organization. I actually ran his campaign, and he completely unexpectedly became the head, the Director General of the World Health Organization. He asked me to come and work with him in Geneva, and I told him on one condition. You have to change the World Health Organization policy on treating HIV in Africa. And what I told him was, this is a fundamental moral and ethical issue. I knew, having studied the drug industry in Korea, that was my research in Korea, having studied the drug industry in Korea, I knew that we could bring the prices of the drugs down dramatically. And I told him, this is what we're going to do. We're going to bring the prices of the drugs down. We're going to quality assure them, and we're going to get them out to everybody. You have to promise me that we'll change the policy, and WHO, the World Health Organization, will become an advocate for treating HIV. And he said, okay, I agree. But when we started, we expected, when we started arguing that we should treat HIV in Africa, the arguments we were getting back, we could hardly believe. Right? They were saying, no, if it were possible, we would have done it. You're crazy, this is too expensive. Well, here's what we did. So, working with a bunch of different people, We brought the price of drugs for 1 year. So when we started, the price of drugs for 1 year for treating HIV was $12,000. We brought that price down through the use of generic drugs to $70 a year. Made it available for everybody, and we started treating. Now, what the arguments that I made at that time, what I said to the people in the public health world, 99.9% who said impossible to treat HIV, the argument I made was that if we turn our backs on the 25 million people in Africa living with HIV, we will forever be remembered as a generation that stood by while a genocide happened. Now, frankly, it didn't move many people, but then we started a movement. We started a movement with inside WHO, which is unheard of. We set a goal of treating 3 million people in just two and a half years, and we didn't reach that goal, but we got over 1 million people on treatment, and it really got everything started. So ever since that experience, it's very difficult for me to accept when someone says that this or that or the other important project is impossible. So I went back. After we had that success, I went back to my job at Harvard Medical School. And then people started asking me to do bigger jobs. I never wanted any of these bigger jobs, but they kept coming to me to ask. I kept interviewing. I became president of Dartmouth College, an Ivy League school. And then just 3 years in, President Obama's team called me and asked me to be president of the World Bank. Now, I've done all those things, and you can imagine becoming president of the World Bank was a huge job. But everywhere I went, especially in Africa, what people kept asking me was, tell us, how did Korea do what it did? How did they possibly go from being one of the poorest countries in the world to now a fully industrialized, advanced country that is creating some of the best movies and music and their industrialization, some of the best technology? How did they do that? Because all of the African leaders wanted to do what Korea did. They felt like, well, Japan was more advanced, China's so big, but Korea, that may be an example we can follow. So of course I felt great pride. Moreover, when I joined the World Bank, I got a packet of materials from the vice president of the East Asia region. And this packet of materials was from 1959. He knew the year I was born. And in 1959, the World Bank said, in its internal documents, we cannot give a loan to Korea, Republic of Korea, because it's too backward. There's not enough people with the right education. It's mostly rural agrarian part of Korea. The industry is in the northern part. Korea is so poor they would never be able to pay back their loans. This was 1959. The first loan happened in 1962. And then, of course, we all know what happened. And so for the time that I was in the World Bank, I kept taking the meetings with these heads of state and ministers of finance who kept wanting to know, how can we repeat what Korea did? And of course, I felt great pride in being able to talk about what I knew of Korea. But we're here today because more recently, I've been asked to take a look at what's going on now in Korea. And I have to tell you, I was very surprised at the numbers that I saw. I'm also incredibly encouraged, Representative Kim Gyo-hong and Representative Jung Chun-sik, the way that you talked about suicide and prevention is exactly what we need. It's become clear to me that this requires a social movement, just like we had when we were fighting AIDS in Africa. But just like every successful health movement has had, it requires a movement. Now, I'm also very concerned about the birth rate in Korea. It's the lowest national birth rate ever recorded in human history. That's a major issue. The highest rate of elderly poverty in Korea among OECD countries. Very high rates of self-reported loneliness. And actually, a friend of mine who is currently the Surgeon General of the United States has told us that if you report that you are lonely in a survey, someone comes to ask you, are you lonely? If you report that you are lonely, just reporting that you are lonely reduces your life expectancy the same amount as smoking 15 cigarettes a day. So being lonely is the equivalent of smoking 3/4 of a pack of cigarettes a day. It's a very serious public health issue. The highest rates, we've already heard, the highest rates of depression among OECD countries, but also the lowest rate of treatment for depression among OECD countries. And of course, all of this condenses down into the suicide numbers. Now, I just want to give you some sense of what these numbers mean. Of course, I'm a trained physician, and of course, being at the World Bank, we take very seriously the numbers, but some of them are really very striking. Suicide is, of course, the #1 cause of death among Koreans in their teens, their 20s, and 30s. And almost half of the deaths in the 20 to 30-year-olds is due to suicide. This number was very disturbing to me. The suicide rate in Koreans in their 70s and 80s is about the same as the suicide rate of Jews living in Germany under the Nazi regime. So among the highest numbers that we've seen. And comparative data, I'm so glad to hear from our representatives that there's a commitment to increasing expenditures. The national budget for mental health care, this is back in 2021, but a total of about 1.9% of the health expenditure in Korea is spent on mental health. The OECD average is 5%, so it's less than half of what the OECD average is. But up to recently, spending on suicide has been even worse. So in 2021 anyway, Korea spent $35 million on suicide prevention, and in Japan, that number was $640 million. So Korea was spending 1/15 the amount that Japan was in terms of suicide prevention. But there's also really great news. In 1985, Japan's suicide rate was double the suicide rate of Korea. But in 2006, that's a really important year, in 2006, a social movement was started. They had a meeting very much like this one. They started a forum, a group, very much like this one in 2006, and there's been a 40% decline from 2003 to 2019. There has been real success in preventing suicide. There are other great examples. Finland had very high suicide rates, 30 per 100,000, similar to where Korea is now. And through many different programs focusing on early detection, active depression treatment, a treatment approach with medication and counseling, increasing social contact, they did many, many things. They dropped the rate from 30 down to 12.9. Less than half of what it was, which is exactly the goal now of Korea. This is doable. This is a problem that we can tackle. So I'm really happy to be here. I'm representing a group that we just formed recently. Ryu Hae-won is in the audience. Dr. Baek Jong-ho is in the audience. Professor Peter Na of Yale University, and the neuroscientist and influencer Chang Dong-sun. We formed a little group called Mind SOS to stand with you and walk with you as we try to tackle this issue of suicide. It's a tremendous inspiration to be here. I am so inspired by what our representatives have told us about their ambition. And I think that 2024 is going to be the year, as we look back historically, just like 2006 was for Japan. It's going to be the year that goes down in history. Everybody will remember that this is the year we started taking suicide prevention seriously. I'd like to see us get from 28, 29 per 100,000 down to as low as Finland got, 12.9. There's so many new ideas out there. There are things like psychological first aid. We can train people in psychological first aid to always be on the lookout for people who might be thinking of hurting themselves. These programs have been shown to be very, very effective. You know, there's so much to do, but as my mother always told me when I was young, starting is half the battle. 시작이 반이다, right? So this is the 시작. We're getting started. I feel so honored to be walking this path with you. We're going to bring experts from all over the world who've had success in tackling this issue to begin a conversation with all of you in this room today. So I want to applaud you for being here. I'm just so glad to see the room full with the civil society members, with the representatives. I really believe that this can be done, and I'm just going to leave you with one example. During the European financial crisis, when Greece was in so much trouble in 2012, my team at the World Bank brought me newspaper articles from Korea in 1998. And they said to me, do you think we can get Greece to do this? And of course we couldn't, because it had never been done before. So just like at that moment, I believe that Korean people are so inventive, so creative, so determined that we will find a solution, and it's going to be the greatest honor in the world to accompany you on that path. 대단히 감사합니다.